Well, hi, Christina. I appreciate you joining me today. And this is Christina Ralko. She's a nurse practitioner and owner of Your Way Pediatrics, located here in Jacksonville, Florida / Nocatee area. But enough of me talking. Thank you for talking with me today.
Thank you. No problem.
So go ahead and tell us a little bit about you and how you got started with your practice.
Sure. So I'm Christina Ralko. I am the owner and provider at Your Way Pediatrics.
Yeah.
I um, I have worked in various settings in outpatient, inpatient clinics, and I saw a lot of constraints with traditional healthcare model.
Mhm.
So I wanted to, uh, just offer more of a quality, extraordinary care to my
Mhm.
patients. And I ended up assisting with the Department of Defense on a humanitarian mission where that's where my passion started with the home visits, although I
Mm.
was seeking out in barracks at
Yeah, yeah,
a camp facility. But I recognized the need for a better healthcare model.
yeah.
And that's when I decided to start my practice in 2022.
Oh, that's awesome. And so how'd you gravitate towards pediatrics?
Gosh, my entire background is pediatrics and
Okay.
adolescence.
Okay.
I think that, kids need a voice and they need an advocate.
Sure.
And sometimes parents may not know the right answer, or they might just need a little bit of additional resources. So
Mhm.
I want to be that person to help bridge that gap. If there's anything that comes up unexpectedly or any questions I can answer.
Awesome. And so it sounds like you come out to, clients' homes and your clients are typically pediatrics. What's the age range that you work with?
I see newborns up to kids in college. I do offer, in-home visits or virtual as well. It depends
Oh, yeah.
on, the family's flexibility. I try to be flexible as well too. So, and I'm always available literally 7 days a week. I was actually seeing some patients on Easter. So,
Oh, wow. I bet they really appreciated that if they were reaching out to you on Easter. So what types of things are you traditionally seeing? Like if are they typically like well visits or are they sick or what's your typical caseload look like?
so I offer services in a variety. So that
Okay.
includes your annual wellness visits,
Great.
sports physicals, sick visits, or urgent care. I do offer IV fluids as well.
Okay.
And I do have quite a bit patients who do need mental health assistance.
Okay. Yeah.
And that includes, diagnostic evaluations, medication management.
Awesome. Yeah, that's an interesting thing, and I wanted to touch on that today. I think that's a very unique part of your practice. So mental health and adolescence, is that right?
Yes.
Okay, and then so like tell me your role in that. So I'm that's just an area I'm a little bit more unfamiliar with, but I know that there is a rise in these mental health issues in our society. So like where do you fit in all that?
There is a very long wait list that I have seen in this area with
Mhm.
mental health. So
Okay.
I am here to, to add additional support
Mhm.
and for diagnostic evaluations, whether it's for ADHD
Okay.
or anxiety, depression. I also started offering gene site testing, and that looks at the, chemical makeup of each individual child and helps determine their effectiveness on specific medications. That way you don't have to go through numerous medication trials if we have to
Okay.
go that route.
Oh, that's really nice. I mean, dialing in specific treatments is great. It reduces, costs, but it also improves effectiveness of the medication or the treatment that you're offering. So that's great. I think that's amazing. Speaking of ADHD, like, if a parent was concerned that their child had ADHD, is that enough to warrant a visit with you?
Yes, I am happy to, do an initial parent meetup.
Okay.
And, that way, if they have any concerns, we can discuss them. I can answer any
Okay.
questions they have. And even if parents are concerned for ADHD and we do that initial evaluation
Yeah.
and the child doesn't meet that initial criteria, there's still other ways to help the child, whether have
Okay.
a diagnosis or not. And that's kind
Okay.
of what led me to the functional medicine aspect as well.
Sure. Yeah, I guess that leads very, well into the next part. So if they're not medically managed, or if they are, like, how does your management typically look? I know you're speaking towards an experience that's way different than a traditional healthcare system. So can you speak on that experience with you and how that's traditionally managed?
Yes. So the my main goal of offering pediatric functional medicine is
Hmm.
to possibly help patients perhaps get off the medications because,
Hmm.
you really shouldn't be on a stimulant medication for a long duration of time.
Sure.
And I also want to make sure that, these children are not going through unnecessary tests or treatments. And I just want to help restore their body back to health naturally, even,
Hmm.
at a young age.
Sure.
And sometimes that could mean perhaps some lab testing or diet changes because a lot of things begin with, the person as a whole and
Hmm.
really want to dig deep into that root cause approach.
Hmm.
Um, Primarily I try to work with diet and lifestyle changes or herbal remedies and supplements and, prescribe medication only when it's absolutely necessary to
Sure.
promote the health and wellness.
Sure. So yeah, I think that's great. And I'm a mobile provider as well. And I kind of understand what you're saying, but how is that experience different than a traditional medical experience? Like, let's say they go to their pediatrician and they bring up these issues as well. Like, how is yours different from that?
So my visits are at least 45 minutes to an hour long. So
Awesome.
there's no rushing
Yeah.
and you always see me. You don't have to see,
Hmm.
a different provider. I'm
Sure.
always, directly accessible 7 days a week.
Yeah.
And also most of the other traditional healthcare providers typically will just work within medication management only.
Sure.
Not any other, additional resources such as, looking at diet or lifestyle changes or the gene site testing.
Yeah. Yeah, I think that's amazing. And those are the same concerns that my clients see as well. But I think with both of our models and yours especially, your patient is, the child, but you're also managing the parents at the same time. And so you need that relationship and that communication with them, and you need that amount of time and provide them options that are beyond just traditional medical management. And so, I mean, as a parent myself, that's what I would be looking for, is somebody that was consistent and heard my child's needs, but also communicated that message clearly to the parent, as well as the child. And I think, when I read something else on your site as well, is that you're good at coordinating care. And so if they do need care outside of you, or they are having their pediatrician appointment, it sounds like that you're very much involved in that process as well.
Yes, I can initiate direct referrals if necessary.
Mhm.
Um, Other providers are, there's a lot of open communication with myself and the other,
Yeah.
complementary providers. And I
Yeah.
always try to leave a lot of the decision making in the hands of the parent
Hmm.
because I think that parents should have that final say in their
Hmm.
child's care without any judgment.
Yeah. Yeah. Yeah, I think that's key. I mean, I just think about our interactions with our pediatrician and our children, and you really want. I mean, I'm a firm believer that no one knows your own body better than you, and for a parent, no one knows your kid better than you, and so just providing them with evidence-based and treatment options, that the child's at the center of those decisions, but then the parent is also able to weigh in, and not just make them forced into a decision they may not want to make. And so I think that's really, really good. And I think like that's what a lot of parents need and a lot of families need in the area.
Yes, yes, and a lot of that goes along with, not just mental health, but,
Hmm.
uh, for example, I see, what's a common, concern in kids? Common colds or ear
Hmm.
infections. So a lot of
Hmm.
parents don't know that, "Oh, if my child has a ear infection," in your conventional conventional healthcare model,
Yeah.
typically you would prescribe antibiotics, but I
Yeah.
try to try other alternatives, such as echinacea, that boosts your immune system naturally, or elderberry, that's an antiviral.
Okay.
So I just try to, try those alternative methods first
Yeah.
too.
Yeah, I think that's great. I mean, we don't, I mean, and we really want to try to shy away from antibiotics as much as we can. I mean, they have a place, but I totally understand what you're saying. It's like in my realm when people are considering spinal surgery, and we're like, well, like maybe we should try these other more conservative ways first. And so I really appreciate that you do that. And I think that's great. And I think parents are more appreciative of that of now more than ever.
Oh
Hmm.
yeah. Yeah. Thank you.
Yeah, yeah. So, I mean, we went through an RSV scare, about 2 years ago. Is that something that you see as well?
Yes, I
Right.
do. There's really not a lot of concerns that I don't see.
Okay.
Um, as far as the sick visits go,
Got it.
so, and I'm always available by text, call, email. All of my
Amazing.
patients, family members, they have my cell phone. They can call, text me anytime. I would much rather, provide reassurance, answer
Mm-hmm.
questions, hopefully save them a trip to the ER.
Yes. Yeah, that's key. I mean, that's worth its weight of gold because, as a parent, you're like, man, I want immediate access of somebody that that knows my child and is going to get back to me. Like, there's a lot of gray of, do I need to go to the ED or urgent care? And, just I mean, I'm sure this is true for you as well, but like just a simple 5-minute phone call can tell you that answer and just give you some reassurance and save you time and money and just the mental headache around so much uncertainty when it comes to a child.
Oh, yes, definitely. And speaking of money, so I am a, out-of-network provider.
Yep.
I do offer super bills, which are
Mhm,
essentially a medical receipt that families can
mhm,
submit to their insurance company for possible reimbursement. And
mhm.
I also just started offering monthly packages that include, so many visits per month, your annual wellness visit. Obviously you can call, text anytime, whether you have a package
Yeah.
or not.
Yeah. Yeah, I think that's great. I mean, if you just hear about the services you offer, it's way different than the traditional medical experience. So you can imagine that the payment structure is going to be different than the traditional medical experience. And I mean, you've got to do what you got to do, but you want to make sure you provide good care and you've got to limit how many people you see as well. You can't see everybody and provide that level of care. Otherwise, you're going to start diluting the experience a little bit. So, I totally understand that. So, I think when people hear of the communication that you offer and the one-on-one care, and then you come out to their home or you do the telehealth visit and it's really individualized and there's no medical assistant or somebody you have to try to communicate to before they reach you. And so saving that person a headache and energy, is worth that extra expense, especially if you have, a child that needs that help. And it's just awesome that you offer the mental health services and the functional medicine approach. And then you also offer the traditional wellness visits or sick visits. It sounds like that you're really able to, have a wide funnel to capture those kids and those parents that really need your help.
Yes. Yep. Exactly.
So what area do you serve? Like where are you seeing people right now?
Gosh, all over,
Okay.
within, St. Johns County, Duval County, I might say this wrong, Nassau County,
Yeah, yeah, there you go.
Clay County. I mean, I drive, within reason.
Yeah.
I'd say within an hour and a half or so of,
Okay.
the St. Johns, County.
Perfect. Yeah, that's great. And then you can see telehealth within the state of Florida. Is that right?
Yes. So I do have some families that live in, Orlando or
Mhm.
Miami that, when in reason, I can assist them, virtually.
Hmm. Yeah, I think that's great. That's a great addition, especially, COVID really made all of that take off. And I think that's an easy way to get some questions answered. And it allows you to just get a snapshot of what's going on. So I think that's great. So you see a variety of clients in the, let's say, Jacksonville, northeastern part of Florida, but also willing to travel a little bit. And I think that's amazing. How long you been doing this again? Like the mobile gig?
So in Florida, since about January of 2022, but
Oh,
just as
awesome.
a whole since
Yeah.
2018.
Awesome. Yeah, I think that's great. And I've really enjoyed getting to know about your practice and what you treat. And so I know there's a lot of people out there that can benefit from your services. What is the easiest way for people to get a hold of you?
I would say you can call, text, or email. I'm happy with any, communication.
Okay.
And I always tell patients if I don't answer, it's, I'm probably with another patient.
Yeah, yeah.
So if they just hang tight for a few minutes, I always get back to them.
That's awesome. Yeah, I know you do. You're great at that. So I think that's great. Well, I think there's a lot of people that are going to benefit, just from knowing that this service is offered not only in the Jacksonville area, but a greater area as well. And that if they're looking for somebody to really dial into their children's health and help them with their growth and their development, as well as address things along the way, it sounds like you're a great fit for those folks.
Thank you. Yeah, I try to provide a broad quality of care and,
Mm-hmm.
whether your child is typically healthy or possibly more complex. I have a lot of, developmental delayed or perhaps, autistic kiddos that I see that,
Okay.
in traditional healthcare office can be really overstimulating for some kids.
Hmm.
And, I want to make them feel at home.
Yeah, man, that's a great point. Like I don't even consider that with my clients. But with you, yeah, going into the clinic is much more of a feat than, necessarily walking into outpatient rehab. So wow, that's a really good point. And I think that only adds value, when not only does the parent, can they stay home if they're, especially if there's other children that they're caring for at the same time, but then that child can feel more at home and just welcome somebody into their space instead of trying to go to a different space. And so man, that's really great. That's really great.
Oh, yeah, and, you can avoid, waiting in, waiting rooms for a long
Mhm.
period of time, and like you said, you don't have to pack up. If you have other children,
Yeah.
you just hang out at your house and wait
Yeah.
until I arrive.
Yeah, that's great. That's awesome. Well, man, I really appreciate you taking the time and talking about your business and the great things that you're doing. I think it's a very unique service and not a lot of people think, that that's even a service that is available to them. And so, I really appreciate you taking the time to chat today.
You're welcome. The pleasure's all mine.
Well, perfect. Well, thanks again. And, I look forward to working with you in the future, but I'm sure we'll be in touch soon.
Alright, sounds great. Thank you again.
Yeah. Bye, Christina.